Welcome to the Birth Launch Podcast, an empowering space for expecting and new parents to hear candid conversations with experts and learn how to craft your ideal birth. We will tackle the scary and weird questions that come up along the way and provide answers that are driven by science and evidence-based recommendations. I'm going to show you how to redefine parenthood and choose what's best aligned for you and your goals. With 10 years of experience in family education and a master's degree in human development and family studies, I'm ready to help you navigate pregnancy and explore your birth options to free yourself of fear surrounding childbirth. My goal is to help you have an informed and confident labor experience, plus an empowered and joyous postpartum. Hi, Alex. Welcome to the show.
Hi, thank you so much for having me. I'm so excited to be here.
Absolutely. I'm very excited to have a conversation that I think is the pendulum swing to the other side. So I think there a couple of years ago was a big push to see if we could keep people on their medications while they were in pregnancy, and that pendulum swung. And now we have wide acceptance of that. And a lot of times we're told, yes, stay on your regular medicine. We'd rather a mentally healthy mom than not one. Obviously, that's a given. But I think a lot of people with their providers are missing the conversation about risk, which is not new to maternity care. There's a lot of things we get all of the benefit in the conversation and we never hear about the risk, or the risks are kind of brushed over. So I'm really excited to dive into SSRIs in pregnancy with you today. So I think that would actually be a great place to start. Could you break it down of what an SSRI is and why someone might be prescribed that in pregnancy, during pregnancy, or even before pregnancy? What are they used for?
Sure. So, an SSRI, to put it in medical terms, is a selective serotonin reuptake inhibitor. And I know that is a really long name, and that's why doctors abbreviate it SSRI. But essentially, what it is it's a class of an antidepressant. There are different classes of antidepressants like SNRIs, MAOI inhibitors. I mean, there's a lot of different ones, but the SSRIs, or the selective serotonin reuptake inhibitors, are generally considered the safest and the most prescribed. Why you'd be prescribed this? They're primarily for treating depression, but then also other disorders such as anxiety or OCD or intrusive thoughts. So, behavioral issues, mental health issues. Why somebody is on it, it's different for each person, but I'd say the primary reason to be on an SSRI typically is for depression or for anxiety. You might be prescribed this prior to pregnancy, or you might be prescribed this during pregnancy to hopefully prevent postpartum depression. But with this, starting any kind of medication in pregnancy, that's also hard too because of your hormonal changes. But the biggest reason for it is because of depression or for anxiety or other mood disorders that you could have.
Oh, sorry, I can't stop laughing. I love
Yeah,
it so much.
she's raising her
Okay.
hand.
Let me gather myself. Let me gather myself.
Okay. I was
Oh
trying
my
not to
goodness.
laugh too.
No, hey, you have a lot more practice at this than I do. And also, I just find the joy in it. I just think it is just really so darling. Thank you for all of that. Okay, so now can you talk to us about what signs and symptoms were you having when you first thought, maybe I should go and ask my provider for some help or have a discussion with somebody? Who did you go to? What were the signs and symptoms? What kind of kicked you off to think, okay, I need a little extra help in my pregnancy?
Right. So I kind of have a really long backstory. I won't go in too in depth with it, but I was medicated as a child for OCD, impulse control, oppositional defiant disorder, anger management, and did I say anxiety? And anxiety as well. Fast forward now to in my 30s and following up with a psychiatrist, a lot of those things were misdiagnosed. So I was treated with medications, with various SSRIs from childhood, probably around age 10 is when I started getting put on these medications. And prior to having our first baby in 2014, I met with a psychiatrist and a general practitioner to see which ones I should possibly wean off of prior to getting pregnant. I was in nursing school at the time, and so I knew the medical side of everything and was very medically orientated, I guess, with when it came to everything and more lean towards wanting medication and all of that stuff, but did wean off of some of my medications that were definitely ones that could cause birth defects. And with my son, I stayed on them. So essentially from childhood, but then, honey, please be quiet, okay? Kept on them then because of anxiety and kind of like OCD tendencies. I was, again, misdiagnosed. My doctor now doesn't think I actually have OCD. I have anxiety with phobia, with a specific phobia. And it's something called, okay, Emmy, Emmeline, you need to go upstairs. Mommy can't talk. Okay. You're being too loud. I know. Or you can sit on my lap, but you have to be quiet. We can't be playing Han Solo right now. Okay. There we go. Now we can be nice and quiet. Daddy will be home soon. Okay, so yes, was treated again since childhood and then had anxiety, intrusive thoughts, and then OCD tendencies, but it's actually a phobia. So emetophobia, which is a severe fear of vomiting. And it's a whole different thing, but stayed on it then on Prozac at the time I was on with my son, very high dose, 80 milligrams, which is, I believe, more than the FDA recommended dose. But what the doctors say with any kind of medication, an SSRI, when you're taking it for anxiety, you will likely need more than the FDA recommended dose. So that's it's another thing that's just challenging, but was on that with him. And my symptoms were pretty mild during his pregnancy and had him at term. He was born posterior. So in that posterior position, sunny side up, looking right at my husband, did have some minor breathing issues after birth. Nothing too severe. They gave him a little bit of blow by oxygen, but they just assumed it was, again, because he was posterior. And after his birth, that's when things started to get a little more crazy for me, to put it mildly again, too. But the postpartum hormones really can kick in. And for people who have any kind of mental health disorder, postpartum can be very challenging. And what's not talked about as much is intrusive thoughts and anxiety postpartum. You hear a lot about postpartum depression and that feeling of just being very down, very depressed, not wanting to get out of bed. And they screen for that. I don't think they do it very well at the 6-week appointment with just a questionnaire. But they don't really talk to you about postpartum anxiety and this rush of hormones that you're going to have that can actually cause these intense intrusive thoughts. And when it first started happening to me, it was terrifying, absolutely horrifying. I would get these like vivid images of harming my child, not wanting to. This is the difference now between intrusive thoughts and actually like a postpartum psychosis. Very different. They are not the same. But basically, when you have intrusive thoughts, you get these thoughts in your head and they're very sticky. They stick there and you can't get them to go away. And what my doctor has always said is with intrusive thoughts, we don't worry about them when they bother you. But if they don't bother you, that's when we worry about them. So I'd had these awful sticky thoughts postpartum. So I wanted to stay on this medication and stayed on it, wanted to be a breast milk donor and could not on Prozac. So fast forward then to 2016 when we had our second. Before we had her, I wanted to switch to a more safe SSRI, which is sertraline or Zoloft is considered one of the safer SSRIs for pregnancy because it's more well studied, and for breastfeeding because it is a large molecule medication, meaning very little, if any, can pass through the breast milk. So you can be a breast milk donor on sertraline. So was switched to that, and I've had varying symptoms on and off, but now that I know that intrusive thoughts happen to me postpartum, it's not as big of a thing because I know it's coming. So I've had 5 babies, had them with everyone. They're worse right away postpartum, tend to get better around 1 year postpartum. The silly thing is, every time I talk to my doctor about it and said, I don't really feel like this medication is helping me. I feel like my symptoms are all the same or staying, whatever. He's like, well, let's just increase it. Let's increase it. Let's increase it. And that's kind of, I guess, the backstory about my medication, and essentially been on it since childhood for anxiety, OCD tendencies, a phobia, and intrusive thoughts. Did that answer the question?
Yeah, absolutely. Okay, and so this idea of having a really, really high dose, despite what the FDA says.
Mhm.
Is that a general recommendation? Is that kind of something you find across the board? What does the data say about that? What do we need to know about this as consumers for anyone listening who is like, "Oh wow, I'm on a very high dose."
Yep. So it is the recommendation, even though the FDA is saying that, we have this max dose, pretty much every psychiatrist I've talked to, and in our area, we have very poor access to mental health care in the area of Wisconsin where I live. I don't know why, but we just can't really keep providers. So I've had several just because providers tend to leave. And everyone I've seen has said the same thing, that people with anxiety or OCD tendencies or phobias need higher doses than what the FDA recommends. And it's just scary because the more you put in your body, the more side effects you have, and the harder it is to come off of something. And if we're saying that, hey, the FDA is saying, well, we shouldn't go higher than this amount, but you actually need to go higher than this amount to treat your symptoms, it just feels very backwards to me. But that is across the board, at least from what I've heard, that yes, because these drugs are technically off label for anxiety, OCD, that's why they can do higher doses, because the primary treatment is for depression.
That is fascinating. I mean, it
Yeah.
does make I mean, it kinda makes sense. I see the logic, but I
Yeah.
also see the holes. I can see where it's not a whole approach either, right?
Yep.
There are pieces missing still. What did it feel like being an adult knowing or not knowing, but finding out that you had been misdiagnosed as a child and medicated for a disorder that you didn't even have?
That's been hard. I I've had to process it, and I'm actually going through a program right now. It's called the Thrive program. I don't know if you've heard of it, but it's based out of the UK, and it can treat emetophobia. So it's
Mhm.
an 8-week long program. You can do it yourself or with a coach. And since starting that, it's helped me to process a lot of the stuff that happened to me in childhood, because even though the part that I'm doing is mostly for my vomit fear, it encompasses everything, and it's about learning to thrive. So even though those things happened to me as a child, my parents made the best choice of what they thought was going on and what they thought was right with the information that they were given. So I don't resent them for it. But at the same time, now I fight more for my kids, where anytime a doctor has just recommended medication, I'm very leery about doing it. So, for example, my son suffers migraines. He's 9, and you can't just get an appointment with a neurologist to get it checked out without seeing your pediatrician. Healthcare in our area is hard to get. So getting him in just to see a locum. And the first thing they say to me is, okay, why are you here? Said, well, my son's been having frequent migraines, like weekly. And she said, well, do you want migraine medication? Said, no, I don't think we do. We want to find out what's going on first. And she goes, well, then why are you here? And it just feels like that's just the jump in our society right now, is a pill to fix it. And I think, again, I don't resent what happened, but I do think starting a medication, something that's supposed to be as simple as an SSRI, that's not supposed to actually have withdrawal effects, but actually does, it's just complicated. And when you do it young, it's harder to get off of it, especially now. I mean, 20 years on and off a medication like this, it's very challenging. And again, don't have anger or resentment about that, but it's stuff that I've kind of had to work through, all those feelings, and just figuring out how to get by with that. And when you know better, you do better, is what I always say. And my parents did the best that they could and what they thought was best, and we know better now, so we do better.
Yeah, absolutely. Okay, you had mentioned your son kind of took a turn for the worse after he was born. What did
Yep.
that look like? And you think that was attached to the SSRI use? Or is that what we're kind of putting
Yep.
together? Okay, what did that
100%.
look like for you?
So his wasn't as severe, but I have 5 children, and every single one of them had breathing issues after birth, and I'll explain that more in depth in a minute. But the Only consistent factor between all 5 of their deliveries, the only one is that I was on an SSRI and a high dose. So that I think makes a difference in terms of dosage. And so I do want to say that if you are on an SSRI, I don't want you to freak out. Figure out, is your dose a high dose? Is it a average dose, a low dose? And also don't just stop something without talking to your doctor, because there are withdrawal symptoms and you should never just stop something. So that's my little, I guess, sidebar on that, is make sure that you're safe and you're not just stopping something without getting help from somebody, whether it's a doctor, a naturopath, or somebody. So for him, his weren't as severe, but he did have some jitteriness, and he was doing something. It's just when they're breathing funny, they almost sigh. So he would go, ah, ah, and the nurses call it singing. So babies can sing, and it can be one indication of respiratory distress. And with him, he did not cry at all, which is fine. Some babies don't cry, but he was very shaky and very jittery. So his respiratory distress wasn't as pronounced as my daughter's was. Again, at the time, I was on Prozac, or the generic form fluoxetine, and was on 80 milligrams, 40 in the morning and 40 at night, which is a very high dose for Prozac. And again, he was very jittery. He was doing all that singing. And so we had to watch him. He was lethargic. And they did give him a little bit of just blow by oxygen, but he didn't need resuscitation or anything like that. But then my daughter, who was born in 2016, so I have one boy and then 4 girls in a row.
One boy.
Yes, and one boy. All of my babies were term and had no other health concerns during pregnancy. So I'll put that out there too. But my daughter was born at 37 weeks. My son was born at 40 on his due date without induction. He likes to talk about that. Pretty rare, kind of cool. That's rare. But daughter was born at 37 weeks. I'd just taken my nursing boards, and I think that stress, which can sometimes stop labor, actually put me into labor. So she's born at 37 weeks, went in, and she had shoulder dystocia. Don't know if it was actual shoulder dystocia or provider impatience. So that's a different story with her. But then she started to have respiratory distress. Now hers were more pronounced. She had nasal flarings. You can actually see their nostrils moving like this, like it's flare, they flare. And then grunting, where she was breathing and kind of doing that sing song sighing. And then she had retractions on her rib cage. That means you could see her working hard to breathe. So we assumed it was because of her shoulder dystocia and the way that she came out, how quickly it was. They, of course, cut the cord right away, which can cause more breathing issues. It took her from me. She had to have oxygen, and everything thankfully resolved. They ran a bunch of tests. They did a chest x-ray on her without asking me, which was very frustrating. I found out about that later. Never asked for permission on that one. And just determined that it was something called TTN, or transient tachypnea of the newborn, meaning your baby had respiratory distress. We don't really know what caused it. Okay. Ended up being perfectly fine. She was healthy. We went home. She had some jaundice. She was 37 weeks and kind of small, had shoulder dystocia, had some bruising. Could be an explanation for the jaundice, but SSRI use during pregnancy could also explain the jaundice. So then third baby, same thing. And she was 38 weeks, 3 days, I believe. Also had the breathing issues, and she did not have shoulder dystocia. My biggest baby, 8 pounds, 10 ounces, no shoulder dystocia, and same breathing issues. Very bruised, had a lot of jaundice, had that grunting, retracting, sighing, had to give her just a little bit of oxygen, but within the first couple hours, resolved. Fourth baby, that's this one right here. She had a very difficult labor, also born term, 38 weeks. She had shoulder dystocia. Hers was probably a true shoulder dystocia. Yes, yours. And same breathing issues, we making faces, that grunting, that sighing. And with all of them, it was like something was starting to click in me. The same thing is happening. What is the same factor? Because all of their birth experiences were very different. They were all healthy. They were all normal. They were all term. Some had shoulder dystocia, some did not. And hers, I thankfully fought the pediatrician and did not let them do the chest x-ray. This time they asked first, thankfully. Still wanted to run a ton of labs on her and wouldn't let us take her home right away, which was frustrating, because with all of my babies with this, and I'll explain what I'm pretty sure it is in a little bit, but it resolves quickly. And they typically don't need anything else after just a little bit of extra oxygen just to get them through. And then fifth baby, hers was my first unmedicated. I didn't have time for anything. It was very quick. Her story is hilarious because my water broke at the spa. Literally a Hollywood moment. I'm not even joking. I mean, I'm at the spa, I'm in labor, in denial because she's baby number 5. Didn't want to miss a maternity massage someone gifted me. And she rolls me over onto my back. I had been on my belly to, massage the front of the legs, and my water just, I mean, it was a full rupture. It wasn't a pretend, like a trickle. It was like gush. And she had to throw out the massage table. So went back postpartum at like 6 months just to, get a postpartum massage, and they were all laughing. They're like, you're the one whose water broke. And yeah, destroyed everything, barely made it to the hospital. Her birth was great. It was what I'd always wanted, the unmedicated, no interventions, nothing. And she was term. She was 38 and 5, a little bit smaller. She was my smallest baby at 6'10", but no issues. And things were going well. I was like, yes, we're finally going to have one that doesn't have this breathing stuff, right? Finally going to have it. Yeah. And within an hour of her birth, I called the nurse in and I said, she's doing it. She's got the flaring, she's got the retracting, she's sighing. Looks like she's having a hard time breathing. Sure enough, they had to take her to the special care nursery, which is frustrating. They won't let the babies be by you. And I explained, this has happened with all of my other babies. I'm pretty sure I know what this is. You're going to label it TTN and it's going to resolve itself. Please, we do not need to do a chest x-ray. Please. So this one I really had to fight. They were adamant. They really wanted to do it. It's protocol. We need to do a chest x-ray. No, I wouldn't let them do it. And they still wanted to run labs on her, ABGs, which are not fun. So those are arterial blood gases. And with those, they have to get the arterial blood and it cannot clot. And they only have a certain amount of time after they get that blood drawn to get it to the lab. And it's awful. It is not, those labs are terrible. And this poor little baby, as nurses, whenever babies had to have excessive labs drawn, we'd say they had hamburger heels because of the amount of times they have to poke them. And they tried to do a draw in her arm and in her feet, and it just wasn't working. And at this time, she's fine, right? Like she showed those symptoms and it resolved, but they kept digging. They kept trying to figure out what was wrong. They kept throwing the NICU at us. They kept saying, if she doesn't get better, she's going to have to be admitted to the NICU. And I said, she is fine. If she wasn't fine, I would obviously, want to have things done. But at this time, her oxygen saturation was great. We want that at least above 90. Otherwise, it starts setting off alarms. And they had these like monitors on her. And that's another thing too, like the machines they put on babies to check their respiratory rate, their heart rate, and their oxygen saturation are not very accurate and give off false alarms all the time. What I like to say is watch the patient, not the machine, because it was falsely alarming continuously that she was in distress, breathing perfectly fine, no issues. And they wouldn't let me nurse her. They were very adamant this time. We could not leave for 2 days, and they had to have repeat labs and repeat labs no matter how many times I said, I think this is the exact same thing that every single one of my children had. So then we go home. Again, she's fine. All of my babies ended up being fine. So that's the moral of this story. It was literally resolved within a few hours. And most cases of what this is called, it is, I have it written down here so I make sure I say it correctly. It's PNAS, or postnatal adaptation syndrome. Okay. Most of these cases, if it's from an SSRI use, will resolve within 48 hours after delivery. So that's really, really encouraging, especially for women who need to be on an SSRI. But what is very discouraging is that the doctors did not listen to us and they kept digging and assuming that something was wrong. But I went home and I started really putting the pieces together, because after my 4th baby, with it continuously happening, and then I started to have the wheels turning that something else was going on. And then with number 5, I'm like, there is something else, like something else is going on. And then I started reading about it and doing my own independent research and looking into studies about SSRI use in pregnancy. And I remember during my 5th baby's pregnancy, probably midway through around 20-ish to 24 weeks of the pregnancy. And it comes back now. My psychiatrist had said, we might want to start weaning you off of your SSRI during pregnancy because there have been some studies that show cases of the PNAS, that postnatal adaptation syndrome. And me thinking, well, none of my other babies had that at the time, thinking that. And I'm feeling well right now. I'm good mentally, I'm good physically, I'm healthy. If I adjust my medication during pregnancy, I know I'm going to have withdrawal symptoms. And then I'm going to feel really icky and really sick, and the hormones are going to make it weird. I really don't think I want to do this. And he's like, well, it's probably okay because we don't know if there's really correlation. But then that conversation came back to me and I remembered it and I asked him about it. And he's like, well, yeah, there's a correlation between SSRI use and breathing difficulties, jaundice, and, the tachypnea is what it's called. So that breathing difficulty, feeding difficulties. Essentially, what's happening, at least or what doctors and these studies are saying, is that these babies are having withdrawal symptoms. They're having, yes, withdrawal symptoms, and that is what is happening. So all of the time during pregnancy, the babies are getting this medication, whether it's just a small amount, they don't know the exact amount. Even a safe SSRI, a well-studied SSRI, they can't do studies on babies. It's not ethical. So we can never know for sure, except for people who report things. But me, for example, had this happen to all my babies, never reported it because I didn't correlate it. And most people probably wouldn't, or I guess most people don't have 5 children. Maybe they do. We just chose to, but it's it's just hard. And there's all these things, but it's these babies are having withdrawal effects. And I know how miserable they feel because I'm currently trying to wean off of an SSRI, and even just taking it down a tiny bit, it's like you feel like you have the flu. You get these chills, you get shakes, you get nausea, dizziness. I have this feeling of like my head floating above my body. It's weird. And I know what it is because anytime I increased my medication for like 1 to 2 weeks, same thing, but decreasing is even harder. So they won't tell you that coming off of the medication is way more challenging than going on it, and that most people who try to come off of it fail. So these poor babies is what I thought, how are they feeling?
Yeah, and all of this is backed up in the literature. You've got the data to back all this up. It seems like you
Yep.
came home and just, like, dove into the research and said, "Wait a minute." And it feels a little gaslighty, like, on one hand, they're like, "Well, report things to us when you see it," and you're like, "But I did, and you kept trying to tell me
Saying
that's
no.
not what it was, or you kept trying to tell me there was something bigger or threatening to take my baby to the NICU when I was reporting what I was seeing." I'm sorry for that. Yeah, you deserved better than
Okay.
that. Yeah.
Thank you.
Yeah, absolutely. I think something I'm very shocked to hear is that they're having withdrawal symptoms that never once occurred to me and never crossed my mind. And I think
Nope.
also being connected to jaundice is very
Yeah.
surprising to me as well. But I guess it makes sense now that we've connected the dots of withdrawal. Their bodies are their kidneys and
Fighting.
liver and stomachs are all just like, yeah, processing this medication withdrawal to process that and
It's
is really
scary.
struggling to kind of keep their bilirubin levels.
They
Yeah,
do, most of these babies, again, the reassuring thing is they do bounce back within 48 hours.
right.
And if you are breastfeeding, it's typically quicker because then they're still getting, again, with Zoloft, it's a large molecule, so not as much, but they're still getting a small amount then in the breast milk. So that initial failure to adapt syndrome, it's not
Yeah.
as much than if you're breastfeeding. So that's also reassuring. So again, if you need to be on these medications, it's not me saying, oh my goodness, don't do it. It's saying we need to be working with our providers and having this awareness that this can happen. And it's actually way more common than they thought, at least in everything that I'm reading. And all of these studies, I mean, the studies are out there. You can even go look yourself at all these studies. It's all public knowledge that, okay, this is really happening even in term infants. And that's what's scary.
Yeah, we'll put all this data in the show notes like we always do for people to check this out because I think like I said in the beginning when I opened up, SSRIs have generally been accepted as pretty safe in pregnancy,
Yep.
and I don't think either one of us are arguing get off your medicine or don't have
Nope.
an SSRI, but more so let's have a transparent conversation with providers and we kind of expect our providers to be the ones that are initiating this conversation, but if they're not, you should ask about the risk and maybe this is a chance for you to educate your provider because they may not know this thing and this
Right.
is a time for you guys to come together and talk about the research. But what do you wish, Alex, that your provider had said to you, I think before they put you on an SSRI? What did you wish that that conversation looked like so that you truly felt informed about the risk?
Well, I think that's hard because the first time I was a child. So in that instance, I just wish that the doctors would have had more conversations with my parents about the long-term effects,
Mhm.
or I guess the unknown. And
Mhm.
then as an adult, when I chose to stay on them, that conversation of, okay, coming off of them, if you ever choose to do so, is very hard. It's very hard. And that the majority of people who are on SSRIs end up staying on them for life, is at least what I found, because not because they need it necessarily. Yes, some people do, but because their bodies cannot adapt to coming off of it. And it is hard. And they have relapse symptoms of irritability, anger, depression that they didn't have before, suicidal thoughts. It even says that on little inserts that they could increase suicidal thoughts when you first start taking them or if you try to come off of them because your brain chemistry is changing. The SSRIs are working on the way that your body absorbs serotonin and the way that it produces it. And you're blocking these channels, the reuptake of the serotonin. It's very interesting. And serotonin is actually created in the gut, which is so cool. And looking back, I wish that a doctor would have said, well, let's check out your gut microbiome, which I know sounds weird, but I've had digestive issues my whole life. It runs in my family, maybe some IBS, never fully diagnosed, but always an upset stomach. So, what if my entire life, my stomach was the issue and it was never my mental health or my anxiety, or it was a correlating factor, right? And then there's also evidence now to support that vitamin deficiencies, like the B vitamins, magnesium, vitamin
D.
D, yes, specifically can be a cause for anxiety, depression, or heightened symptoms. So, why shouldn't we, if we're going to treat it, try and treat it with something that's not addictive first? They will say it's not addictive, but anything you read, and when you read the symptoms of what can happen when you're coming off of it, how is that not an addiction? Now, it's not a controlled substance, so you yourself, I guess, do not have that pleasure response necessarily, that external where you're like, I want to take this. It's more so where I feel is, oh my gosh, if I don't take this, did I miss a dose? Oh, that explains why I feel sick today. And also, like the pharmacies, it's not a controlled substance. But if you don't have your prescription, whether you've been on it like me for years from your doctor and you don't have that, they will not fill it for you. And so then you miss a day or two and it's like misery. Now, this is again a high dose. Some people who are on lower doses might not experience this. Everyone's body chemistry is different. You can get something done called a gene site test. I don't know if you've ever heard of that.
No.
It is really cool. I had it done, goodness, probably like 10 years ago, because all of these medications I have been on like the gamut of SSRIs. They've pretty much all of them have made me feel dizzy, nauseous, fatigued. And the doctor would just say, well, it's your anxiety. It's your anxiety. And I'd say, I'm not feeling anxious right now. I'm feeling fine mentally, but I feel miserable physically. And these medications can cause these things to happen and these symptoms. So the gene site test, what it does is it's just a swab in your mouth. Some insurance companies cover it, and if they don't, I think it's pretty expensive, but I'm pretty sure most do now. So we had that done, and what it does is they test your DNA to see which medications will react what way with your body based on your DNA. Super cool. And this is how you
Wow.
can, yeah. So it was newer when I first got it done. So I think it's more recognized and insurances cover it more now than they did back then. But it's super cool because you can see what medications are more likely to be problematic for your body based on your genes. And it also can look at your folate, your folic acid. So do you have the MTHFR mutation? That's that gene mutation where your body isn't able to absorb the synthetic form of folic acid, which is folate, which is in like everything. Excuse me, I might have those backward. Folate is the synthetic, or folic acid is the folic acid, I think, is the synthetic, and folate is the non. But don't quote me on that. I have to look it up. There's one that's synthetic and one that's not. And if you have that mutation and it's activated, so it could be turned on, it might not be turned on, then you have issues with folic acid synthesis. And the GeneSight test tests that. So this tells you it, you look at all of your things and it gives you this full profile. It even looks at anti-inflammatory medications, right? Like ibuprofen and things like that, that might not be good for your body, or it'll tell you either your body will possibly react to this, your body can't handle this, or you have to have higher doses of this for it to be more effective. And what my GeneSight test said about pretty much every single SSRI that I've tried is that I'm very sensitive to them. And every time my doctor's like, hey, but we need to increase it. Let's keep going up. But you might have more side effects. And I mean, I have been for years trying to figure out what is causing my daily nausea, dizziness, like weird feeling, fatigue. Kept being told over and over again it's anxiety. It's just your anxiety causing this. Well, I'm not anxious right now. So just went and had a bunch of blood work done, and everything is relatively normal. I'm going to get some of the vitamin levels checked, though. I didn't have those checked, but someone finally said to me, bless them, maybe it's your medication. Yeah, maybe it is. Maybe it is.
Maybe. Maybe after all of this, it is. Okay,
Yeah.
do you ever think about your children's gut health, or do you ever see things in your children's gut health maybe that is connected to the SSRIs that they were exposed to in utero?
Oh, I'm not positive, but my oldest, so he was the only one that I was on the Prozac with, and he has more digestive issues than my other kids, or like when he gets like a stomach bug, he tends to get more sick than my girls do. I was on sertraline with the girls, but not on as high of a dose until my fifth one, where it was a higher. But my son, he does seem to have more digestive issues. And then my middle child, my middle daughter, who's 6, she she's got to have something going on with her gut. She has to, because she will not eat anything. And it's not just a, simple like, oh, I don't want to eat that. Because this girl like is adamant that she won't eat like anything, to the point of she's had such low blood sugar in the mornings on occasion from refusing to eat, when we've said, well, if you don't eat your dinner, we're not just going to let you have whatever you want, like most parents do, right? They say, well, you need to eat your food given, try it, and if you don't like it, then we'll get you something else. But she like won't even try it,
Refuse.
and then will
Yeah.
throw up in the morning because she's got such low blood sugar. So now we
Mm,
have to give her like a string cheese or something if she doesn't eat her dinner. But she's really sensitive to like textures and like different flavors and like spices, and just sensitive to all that stuff. And I wonder if there's some kind of correlation. And we do give our kids probiotics, but it's just a standard strain with,
yep.
I think it's got Saccharomyces boulardii is one of them. And then like the L. reuteri, I think it's called. Those are like the standard probiotic strains. There's so many strains,
Yeah.
but I mean, it's got to all be correlated. It does. And another reason I want to get off of these is we would love to have more children if that's, what the Lord wills for us. If it's like, hey, we have something in our marriage where we have an open womb policy where if we're supposed to have more kids, we will. And some people might say that's irresponsible, but we also are choosing to trust God in that, hey, if we are gifted with more blessings, we're going to accept them. But if that were to happen, the thought of being on this high dose terrifies me. And so trying to just come off of it now, or at least reduce it. So that's what I'm at right now, is reducing it to a lower, safer FDA dose and see what happens. But I don't want to go through that again. Even though it was resolved, they were okay. It's just scary. I mean, seeing your child have a difficult time breathing and you being the one who sees it and then not being trusted to then monitor it. Like I don't like to tell them that I'm a nurse. I worked with most of them, but some of them don't know me anymore because I haven't been in labor and delivery nursing now since having my third baby. So some of the newer nurses don't know me, but it's like they don't trust you.
Mm. To
I
make
saw big
decisions for
breathing
your
issues.
baby.
Yeah. And even like someone who has a degree in nursing and is the
Mm.
one who said, "Hey, my child is having signs of breathing distress." And then, but we don't trust you to monitor that, even when she's perfectly fine. It's really hard. And when you have those emotions postpartum and all the hormones, it's like I just broke down and was so upset because they would not let me nurse my baby because we have to monitor her. We have to monitor. But she's okay. Again, I want to say that if she wasn't okay and if she was still in distress, it would have been a different story, right? But she was fine. All of my babies were fine within like an hour or two, and they just needed all of them, no resuscitation, just a tiny bit of blow by oxygen. That was it. And then they were good. So that's what's frustrating.
Yeah, and it really sets your postpartum up for like such a rocky emotional start where it could have been a much different story had the
Yep.
support looked a little different and just had a different approach.
Yep. And
Yeah.
it's very frustrating. And my husband fought for me then with that, with our fifth baby. And he's like, hey, because again, I don't like to go and tell medical professionals that I'm a nurse because it just feels kind of like you're throwing your degree in their face.
Hmm.
And he goes up to the pediatrician. He's like, and he's not a confrontational person at all. So this was like huge in our marriage where he's like, hey, like he went and fought for me. He's like, she knows what she's doing. She's the one who saw this. All of our babies had this. You need to listen to her and stop listening to the machines that are lying. And it was like, thank you. Thank
Yes.
you.
Yes.
And they listened to a man, which, like, okay,
Of course
I
they
guess
did.
that's where we're at. We listened to a man. Thank you for doing that. And then we were able to go home the next day, but they still made us stay with all of them for at least 48 hours for repeat
Mm.
labs.
Mm. Yeah, that's hard. I think that there's a threshold that medical providers are comfortable with, and once you pass that, once you cross that, they really enter into this fight or flight survival type mode, and they really start practicing defensive medicine. Not that they weren't before, but it becomes
No.
like extra, veiled in defensive medicine. Okay, so I guess I have a question. We're trying to wean off of your medication. What are
Yep.
you doing supplementary slash, I guess it's a double barrel question. What's your plan if you do get pregnant again? It would not be to get back on medication if you had been able to successfully wean, and I guess if you
Correct.
had not, you would just try and stay at the low dose that you had been able to come down to. Is that right?
Yep. So the plan now, I'm very in tune with, I've tried to come off medications before many years ago and then ended up back on them. But again, knowing what I know now, things are just different. And I've gone through, again, like I said, the Thrive program. So that's to manage my anxiety. And so some of those reasons that I came back on them, I don't think are necessarily going to be there. But what I will say is that you need to have a good support system and you need to be open and honest with yourself, especially with any of these mental health concerns. And I said to my husband, like, this is not just a whim. This is something that I've felt for a long time. And my why isn't just for me, it's for our children and it's for any potential future children that I don't want to take that chance again. And also, now that I know different ways to manage my anxiety and my intrusive thoughts, and I know that there's a huge factor with your vitamins and your gut health, let's try this. Let's try this and let's monitor it and let's see if I can get off of this medication and not be like a slave to it because that's what it feels like. It feels like you're trapped and you're stuck and you're at the mercy then of the pharmacy and the pharmaceutical industry and like you're stuck on something whereas there aren't as many known withdrawal effects if you stop taking a vitamin unless you're really deficient, right? So the plan is to hopefully get completely off of it. I'm going to go slower than I did now. I probably reduced it by too much, by about 33% is what I reduced it by. But my thing was the first night, because I take a divided dose, and I don't know if I mentioned this before, but it's 100 milligrams in the morning and 50 at night, and was waking up for the last 2 years since I started that, with like nausea, dizziness, shaking, almost feeling like low blood sugar and like a racing heart every morning since starting that 50 milligrams before bed. So I think it's correlated, but I started then Sunday night and just cut it in half, but I felt horrible the next day, even just cutting it in half. That I went from 50 to 25. So I said, I'm going to feel horrible anyways. Let's just cut out the nighttime dose and like not prolong the misery, I guess, of like the withdrawal symptoms since I'm already feeling them by only cutting it in half. So the goal for now is to feel better on getting rid of the nighttime dose. And I'm hoping that within a week or two, everything's going to stabilize and then I'll just be on that morning dose. And then eventually going at a more, what they recommend is like a 10% reduction per week. So yeah, it's a taper method and you have to go very slow. So then I would take that 100 and I would cut it down to 90 for a week and then to 80, 70, and it would take 10 weeks then to get off of it essentially. But also monitoring symptoms and knowing that it takes at least 6 weeks, if not more, for the medication to get out of your body. So you might not know if it's, I guess, affecting you or not until it's completely out of your system. But then also managing it with supplementing. I'm going to be going in and getting my vitamin D level checked and my B12. And there was one other vitamin that I was going to have checked as well. I can't remember. I wrote that one down. One of the other B vitamins, I believe, and just see where I'm at. And that'll give me a good baseline because SSRIs can also deplete your vitamin stores and your mineral stores, which is mind blowing to me. If you're already deficient in them, and that's possibly the reason you have anxiety, and now they're going to deplete you of it more, aren't you going to get more anxious and then be more dependent on medication? So it's a vicious circle, this cycle that
And
just
how
keeps
do we know that
going.
that wasn't the plan all along, right? How do we know that
Yeah.
that wasn't a positive side effect where they found like, oh, well, it depletes them anyway. Well, now we have lifelong patient. Like now this
Yeah.
person will never be able to get off of it. And it seems like that's what the data, kind of backs up is that most people
Yes.
are on it lifelong, not because they actually need it, but you said because
You're
they
stuck.
are afraid of the withdrawals and they are afraid of the symptoms of what will happen if they don't take it.
Yes.
That's sneaky, sneaky.
And the
Smells fishy.
shame too. There's
Uh-huh.
shame. So when I say that, it's a lot of people with mental health, there's a lot of shame, right? Just in general, that, oh, you have this or you have that, like it's a mental thing. But then also, even with friends and family, well meaning, but they'll say things like, for example, today I got a comment, well, you probably shouldn't come off of that because what's going to happen if you come off of it? Like, are
Mm.
you going to go crazy or are you going to crash or will you be able to handle it? Or even got another one today, you're just going to end up back on it. So there's like this stigma too that you're going to have to stay on a medication or that it's wrong of you to want to come off of a medication, which again, I'm one of those people who is very in tune with how I'm feeling. And if I recognize any of those warning signs in myself, which are the intrusive thoughts or just like heightened anxiety, then I'm not going to just sit around and do nothing. I'm going to make sure I'm letting my husband know and then getting the help that I need. But in the same breath, the help that I need might not be pharmaceutical in nature. It might be chiropractic care and vitamin and mineral supplementation and time outside in the
Gut health.
sunshine, like, yeah, gut health. Like these things are so overlooked because we live in a society that's very much just wanting to take a pill to fix it and get the quick fix and not get to the root cause. And I've read the root cause protocol. I don't know if you've heard of that. Yep. So started diving into that this summer. And then another group that I follow on Facebook, it's pretty big, the Iron Protocol group. Have you
Mm-mm.
heard of that one?
Nope.
So that is another mind-blowing thing that I think everybody in the world should go and get their ferritin level checked because that is your iron store, right? And most people who are checked for anemia is a symptom of iron deficiency. It is not causing iron deficiency. It's the body saying that there's something else going on. So you can have iron deficiency without anemia, and that can cause depression. That can cause anxiety, which is mind blowing. So the Iron Protocol group on Facebook, it's free, it's growing. She has a website as well, and I just ordered her book and did like a deep dive into that because I was trying to figure out where my symptoms were. And that was the group that said, I bet it's your SSRI. But your ferritin level, doctors don't check that. And if your ferritin level is under 30, you have absolute iron deficiency, no doubt about it, regardless of what your hemoglobin or hematocrit says. For example, my friend, we both went and got our ferritin levels checked this last week. She has been miserable for years, insomnia and anxiety, depression, not wanting to do anything, always exhausted, told that she doesn't have anemia when in her ferritin level was 15. 15. Okay? That's bad.
Bad.
That's bad. So she is going to start supplementing with iron, and there's different types of iron. The one that is commonly prescribed, it's a ferrous sulfate iron, which is an iron salt. It's actually not very well absorbed by the body. So a lot of women will get prescribed that postpartum, right? An iron pill, and it's usually ferrous sulfate. And
It
in
won't
order for
work.
your what?
And it won't work.
No, because you need to have at least 1,000 milligrams of vitamin C to absorb that iron, and you can't take it with food or coffee. And what mom is not going to take their iron pill without their coffee postpartum? I mean, I don't know. So it's crazy. So that's another group to look at to help, because if you're feeling icky, it could be your iron, and it could
Mm.
have been overlooked by your doctor because you didn't know that your ferritin is what mattered, not necessarily your hemoglobin and hematocrit. All
Wow.
just mind-blowing stuff that I've been reading about. And it's not like woo-woo stuff. It's real, and it's research and science based. It's not, made up things.
Well, it's just things that people should be aware of if they are going to decide that this is the right choice for them. So it's not about SSRIs being right or wrong for you. It's
No.
about, if you choose this and it is right for you, then maybe you want to stick in some, desiccated beef liver pills into your regimen, or
Yeah.
you want to stick in some, blackstrap molasses for some extra iron in your
Yes.
diet, or, maybe you want to be having conversations with your provider about what is the protocol for babies who exhibit these withdrawal symptoms from an SSRI after birth. What does that look like? What can you expect in postpartum? So I think it's more about being prepared than it is being
Awareness too.
fearful. Yeah,
Yeah.
totally. Yeah, just
And
aware that it's a possibility.
yeah, because again, if the doctors would have listened, and their protocol is to do chest x-ray and
Mm.
labs for breathing distress. But if you know ahead of time that this mom is on an SSRI that could potentially cause this, is that still going to be your protocol then? Or would it be better to change your protocol, right? Protocols can change. Change your protocol that we can expect that this could happen to this baby, be prepared, and then monitor instead of going right into chest x-ray labs, NICU, especially if the baby ends up being okay. Now, again, if the baby isn't okay, that's a different story. But most of these babies within 48 hours, and mine were all within like 1 to 3 hours, resolved very well.
Yeah. I think that should bring a lot of people comfort is that it is resolved quickly.
Yes,
And now after this episode, you know what you're looking for. You know what the signs and symptoms kind of look like so that you can alert your medical staff if they don't catch it. But a lot of medical staff definitely will.
right.
Alex, this has been a powerful conversation. I think this has been. Well, I know for me, it's been very mind blowing. It has been eye opening, and I think for a lot of people who are on SSRIs, this is the conversation that was missing. They may not have even known that
Yeah,
this was the conversation that was missing, but now they can take these questions and these thoughts and these concerns, if there are any, to their doctor and have this conversation. Is there anything else that you would tell a mom that was on an SSRI or thinking about it, or that you wish somebody had told you along your journey?
I definitely think that to not be ashamed if you do feel like you need something,
Yeah,
and that it's okay, and that it's not
definitely.
wrong, and that it's not necessarily going to harm your baby, or that you're not bad if you want to take something or need to, because there is that stigma. And we obviously, as moms, we want to protect our children, but in that same breath, that if you need it to be healthy, that is the best way to protect your child. And that's what it was for me with my first few pregnancies before I knew what I knew, was that I needed this to be healthy so that I could care for myself and care for my baby. And if you need a medication, again, that is okay, but you need to be aware of the things that could potentially happen so that if they do, you know what to do or how to handle them. And also that if something isn't feeling right to you, to not just deal with it because the doctor said it's okay or the doctor said you need it. So for me, when they just wanted to keep increasing my medication, I wish I would have known how hard it would be to come off of it. And knowing that the doctors even say too, I haven't mentioned this yet, but that it's got to be almost like a 50-50 or a almost like 30-70 when it comes to treating mental health disorders, that the medication only does so much. And you have to also do some kind of, it doesn't necessarily have to be therapy, but you have to work on it on your own as well,
Mhm.
whether that is, talk therapy or cognitive behavioral therapy, or like I'm doing the Thrive program. Medications are not typically effective on their own. It has to be with another factor. And that was briefly mentioned to me, but it wasn't really as big of a point.
Mhm.
So for women who are taking medication and not really feeling much relief, look into adding on another facet, right? Like adding on some type of therapy or a support group, anything, talk therapy, whatever, just so that you're treating both sides because medication alone is probably not going to make you feel better.
I love that you make that point. Is there anything that you would tell people who are struggling with intrusive thoughts and maybe dealing with that guilt or shame that comes with those?
That was what was the hardest for me, honestly. And that's why I wanted to be on medication because I was terrified of myself. I kept saying,
Mm.
I need to be locked up in a mental facility. Like, I need to go to jail. What if I harm my child? And it was terrifying. And I was afraid of it. And at first, afraid to talk about it, but then recognizing in me that something isn't right. And thankfully, went and told my husband about it first, and then went and talked to the doctor. And then learning that, oh my goodness, this is very, very common postpartum because you have such a massive fluctuation in hormones. And when you love someone so much, like that little baby, and there are just these intense emotions, and you want to protect them so much, sometimes your brain can't handle that. So it does something strange. I don't know if you've heard of this before, but there are moms who will like lick their child or like nibble them, which
Yeah.
I've never done that, but it's you're having this huge response where you're smelling your baby and you're so in love and your brain like kind of twitches and it's like I need to do something because this is such a strong response. So for moms who get intrusive thoughts, we don't lick our baby or like nibble their hair like other moms do, which can be normal if you do that. That's not weird. It's normal. I just never did it. But it's that weird mental shift where now your brain's like, I need to throw in something to offset that intense love emotion. And it's normal. And I didn't know that. And I was terrified of myself. And I think if more women knew that, goodness, intrusive thoughts are so common, and as long as what I always tell women, as long as you don't want them there and they're bothersome to you, then it's okay. Now, if you're having these thoughts and you want to act on them at any time, then that could be postpartum psychosis and you need to get emergency help. And
Mhm.
that is different, but that is super, super rare. And just feeling that what you're experiencing, how horrifying it is and how awful it is and how sick it makes you feel, it's normal and you're not going to have a mental breakdown and you're not going to harm your child or you're not going to accidentally drop your child or these things that these thoughts women have. I mean, they can be pretty graphic and
Mhm.
awful,
Mhm.
but that's all they are. They're thoughts. And that's why they stick because they're awful. If you have a thought, a random thought like, "Oh, okay, what if I trip on the carpet?" And it's just you alone. Like, okay, that's just a thought. It's probably not going to bother you because it doesn't really affect anybody else. But now let's say you're holding your baby. What if I trip on the carpet and drop my baby? Now your mind's going to freak out and you're not going to be able to let that go. And that's an example of them. So to know that there's nothing wrong with you, you're normal, it's okay, and to not give power to the thoughts, what you need to do is talk about them.
Mhm.
Talk about them with someone, no matter how awful they are, how much they scare you, because the more you keep them in, the more they grow and the worse they become.
Yeah. Yeah, that open line of communication, having that safe person, it could be your partner, it could be a therapist, it could be a friend, it could be your parent. Having
Anybody.
that person, yeah, literally, and multiple people. You can have
Yeah.
multiple people that you talk to about this. I'm all about building your village prenatally for postpartum, and it
Yes.
includes this, right? Making sure that you have the right people around you to help you through these really tough but normal, very common experiences in postpartum that I think our society does a really poor job of talking about. So I am very grateful for you to join us today or for joining us today. And I'm very grateful for you sharing your story. And I'm especially grateful for the way that you present this topic. I am always a little concerned when people come on the podcast because I never know how they're going to present their topic. And you have a very scary topic, you have a really sensitive topic, and it affects a lot of people. And it can be really easy to get caught up in the scary part, and you do a wonderful job of making it not scary and making it more about here are your options, here are the questions that you can ask your provider, and here's what you need to know if this is part of your story so that you can be educated and be informed on what may happen to your baby, what may happen with your baby, what decisions you may face in postpartum, and the decisions that you have in pregnancy that nobody might be talking to you about. So, thank you very, very, very much for coming on the show today and sharing your wisdom and your experience and the research and the data that you have done over the last couple years. We really appreciate that. Where can people connect with you if they're interested in hearing more or working with you or learning more about your story? Where can people find you?
Well, first of all, thank you so much for having me. This was so fun, and I'm just excited to share information with people that could help. That's my goal in everything, is to just help people, to make them informed and to just spread awareness and support women. It's what I love to do, and it's such a blessing. So thank you for having me. I have an Instagram account. It's at birth from above, all one word. I think I have a Facebook group as well, but I'm not on that as much. But the one on Instagram, definitely look up me there. And I'm still small enough that I will respond to all of your direct messages if you have questions right now. So that's a little benefit at the moment.
I still respond to everybody's messages as well because I love it so much. So be careful.
Oh,
You might get
wow.
addicted to your community and not be able to get away. No, yeah, I love chatting with our people on Instagram. All right, you guys, thanks so much for hanging out with us today. I hope that Alex's story was inspiring to you. I hope that it got your wheels turning. And I hope that if you're on an SSRI, you feel less alone after hearing this episode and you feel empowered with some questions that you can then take into your provider and have a deeper conversation if this is applicable to you and your pregnancy and your birth story. I will see you at the next episode. And until then, head over to Instagram, find Alex, and you can find me at Tranquility by He or at the.birth.lounge. Until next time, bye. Thanks for joining us. I'll see you next time on the Birth Lounge podcast. Until then, head over to Instagram and find us at Tranquility by He and give us a follow. You can also check us out at thebirthlounge.com.